researchers have studied um, understanding how like awe improves one's sense of connection, of generosity, of compassion and kindness, improves relationships, political open-mindedness, as we already talked about. There's a really great what's called a white paper that UC Berkeley Greater Good Science Center has out on awe. So I would recommend if your listeners, if they're interested in kind of diving more into that nuances of that research, to look at that paper. Um, and then, as I already sort of shared a bit about my own research, we saw decreases of depression and anxiety. I mean, the depression decrease of 36% is just really quite mind-boggling in a program where we had people practice auth just 3 times a day over 21 days. And then saw some longitudinal data supporting that long-term as well. So I will talk a little bit about like what's actually happening in the physiology, because I think that's sort of what you're really kind of curious about, and like what's going on. So um, a few things, like there's sort of 4 key things that are happening. We know that when people have experiences of awe, this is from a 2017 paper, that there is a release of oxytocin, which is, I think, pretty well known as being the sort of trust bonding hormone. So that is sort of pumped out when we have these positive experiences of awe. Also, in terms of what's going on in the autonomic nervous system, the vagus nerve, which is thought is really being sort of one of like the master control system of our unconscious nervous system, and running the show, like so to speak, in incredible ways. There's a For those that like to read magazine articles, Scientific American just came out with a piece in last month's January article, was all about the vagus nerve. Just brilliant, brilliant article. Just involved how the vagus nerve is involved with chronic inflammation and a lot of chronic illness, as well as just general management of our heart, blood pressure, heart rate. They call it your vagal tone. And so it is, the vagus nerve is critical to optimally managing our stress and how we are interacting with the world, and managing all that data. And so when we are doing practices of self-care, we're increasing what's called our vagal tone and better able to deal with stress out there in the world. So the awe practice increases one's vagal tone. In particular, the awe method that we teach, there's a breath component involved with it, which we haven't done the method yet, but we have people take a really long, nice exhale in and a slow exhale out as sort of finishing the sort of short practice, this microdose. And the vagus nerve attaches to the bottom of the diaphragm. It has up in the brain and it goes down to all of our visceral organs, and there's a big anchor in the diaphragm. And so when we take that long, big breath of expanding our diaphragm, we are giving the vagus nerve like a healthy dose of like stimulation, saying like, hey, like do your job and calm us down. And I think if the listeners just do this even right now, if we take a big breath in and a nice long exhale out, we can feel like a real soothing and a calming. Even my voice just sort of slowed down a bit and feels grounded and rooted. So we know the awe practice is increasing vagal tone and helping with the vagus nerve. Another area is what's called the default mode network. So with these brain scans, we know that the monkey part of the brain, where we're having all these random thoughts all throughout our day, our daydreaming, our inner chatter, it slows down. We put people in scanners, we look at their brains when they're having moments of awe, that chatter part of the brain slows down. So awe brings us into the present moment, and our mind quiets down, which is a good thing in terms of brain health. And then the last part is this inflammatory story, which I'll just share a little kind of glimpse about why I find that this is like particularly so awe-inspiring. So our immune system is made up of what are called cytokines. They're these protein molecules that are basically saying friend or foe. This technology that we have is 4 billion years old. When the first cellular organisms came onto life on this planet, they used these cytokines to basically say, you're my friend and you're my foe. And we have this 4 billion year old technology of like what's going on in our own immune system and our own physiology all the time. So we are part of that initial birth of life. Obviously we are, but just to say like, that ancient technology of friend versus foe is what's working, is how our immune system is basically working. So the big bad kind of gangster of this is what's called interleukin 6, IL-6. For people that have remember with the COVID pandemic and people were dying from not really much from COVID per se, but because their own bodies were attacking with cytokine storm, reacting to the COVID virus. So IL-6 is sort of that mastermind that's sort of running the show and beating everyone up. So this is in a Journal of Motion paper from 2018. Blood levels were taken of people that were experiencing different, what we think of positive emotions. And awe was the only positive emotion that actually lowers these inflammatory cytokines, IL-6 in the bloodstream. So you dose moments of awe, and we see an immediate decrease of inflammation in our body. And if you think about the sort of microdosing practice and like the power it has, that if we're practicing this multiple times a day, we're giving ourselves like a significant change in our immune system and our inflammatory state, which has like incredible benefit for our overall health and well-being.